Hi, I'm Barbara Lucas, and welcome to the Green Room, where we explore the environmental topics that green up our world. Today's topic is the connection between human health care provided by hospitals and the health of our environment. Our guests are Nicki Milgrom, who directs the Sustainable Food Healthy Communities program at the Ecology Center in Ann Arbor, and Dan Bair, who runs the Farm and Farmers Market at St. Joseph's Mercy Hospital. Nicki is also the Michigan Regional Organizer for Healthcare Without Harm's Healthy Food and Healthcare program. Nicki, what's the mission of Healthcare Without Harm?
Healthcare Without Harm works to transform worldwide the healthcare sector to one that is ecologically sustainable and is a leader in advancing environmental health and justice. So one way we like to explain it is the Hippocratic Oath says, first do no harm. So we believe that healthcare providers should be helping to eliminate practices that contribute to harm of humans, human health, and the environment.
So their website has all kinds of initiatives, and we're not going to get a chance to touch on all of them by any means, but let's talk about, for instance, climate change. Why should hospitals be concerned about that?
Climate change has a number of human health impacts. So from the unreliability of seasons and the ability to produce food definitely undermines our ability to nourish human beings. Adverse weather impacts, increasing scarcity of water, overall our ability to respond to environmental and weather threats have a number of implications for human health, and the healthcare sector is the one responding to those, to promoting health. And so the idea behind that is, as a sector with a large impact and footprint, it should be consciously trying to reduce that in its mission to promote health and wellness.
I read on the website that European hospitals have like half the carbon dioxide footprint of U.S. hospitals, so I guess it's possible to reduce the impact that way.
Absolutely. There are a number of different measures that are available to the sector to be able to reduce their impact.
Mm-hmm. And how about the products? You mentioned the huge purchasing power, I think you were alluding to. Mm-hmm. Hospitals are something like 18% of the GDP, mm-hmm. which is amazing. So what are some of the things that hospitals can buy that are more sustainable?
Well, so as you mentioned, the healthcare sector accounts for almost 18% of the GDP. So anything they purchase has a major impact. And so by purchasing products that are produced more sustainably and that have fewer impacts for human health and environmental health, really helps to shift supply and demand. It's what we call market transformation work. And we look at that anywhere from the cleaners being used and safer chemicals, which has major impacts for the staff as well as the patients that are inhaling the air all day, but also from medical devices. So, for example, the IV bags or other devices that are used that can leach toxic chemicals into some of the most vulnerable people. Yeah. And so how can we start purchasing and investing those dollars and leveraging that purchasing power to drive more sustainable products?
Great. And even things like water bottles. I noticed at St. Joe's they're selling Nalgene bottles that say the farm.
Yes, that's right. Yeah, we sell Nalgene bottles that say the farm at St. Joe's on them, so it's a way to get the word out about our program, but it's also a way to encourage people to drink a healthier beverage, but also, you know, we realize that it also is cutting out waste from using throwaway or recycled water bottles from the store. So we would prefer to see people use a reusable water bottle.
And didn't you mention that they use real utensils in the cafe instead of throwaway?
Yeah, at our deli in the Reichert Health Building, we do use real silverware utensils. So, yeah.
Great, love it.
Yeah.
So waste is a big topic for hospitals. It used to be mostly dealt with incineration, right?
Mm-hmm. That's actually how Healthcare Without Harm first started.
Oh, yeah?
So In, I believe it was 1994, the US EPA determined that medical waste incineration was the #1 contributor of dioxin, which is a very strong carcinogen. And this idea that hospitals were contributing to harm, so their incineration of their waste was contributing to dioxin in the air pollution. And so the very practices that the healthcare sector was doing themselves were contributing to harm rather than health. And as we started to look more closely across different types of sectors within healthcare, it was sort of this juxtaposition. So the healthcare sector is committed to health and well-being and health promotion. And healthcare providers have taken an oath to do no harm, but a number of their practices are actually contributing to harm rather than health.
And some of it's not necessarily really dangerous, but it's just wasteful. Like I guess the ORs contribute some between 20 to 30% of the hospital's total waste volume with all that throwaway stuff, and that they're trying to go to more reusable surgical gowns and. Back like in the old days.
Right, or even recycling and packaging. So you think of all of the different tools in what they call blue wrap that are sterilized for the surgery, and that blue wrap can actually be recycled and reused. So there are a number of different strategies that hospitals can implement to reduce their waste overall.
I wonder if they'll ever get into composting some of those paper products, because I know food composting is getting to be more talked about, at least.
Food waste is definitely a big issue, and it's actually one of the strategies that a number of hospitals have used. So in being able to invest their hefty food budgets in more local and sustainable foods to help drive and advance a more sustainable food system, sometimes it can be more expensive, and so they're looking for other ways to reduce costs and cost savings. And one of those ways has been to increase efficiency and have less food waste overall, and allows them to use more of their food budget on investing in sustainable and locally produced foods.
So win-win-win.
Absolutely.
Yeah, speaking of food, I just happened to see in the New York Times this morning an article by Dr. Dean Ornish, who was advocating a plant-based diet. I think the title was "What's Good for You is Good for Our Planet." And so maybe you could address how a plant-based diet is helpful to the environment.
So we look at, as you had mentioned, my focus is on healthy food, and I think it's important to realize that we define healthy food as not just the nutritional components that one is eating, but healthy food comes from a larger food system. That system should be environmentally sustainable, economically viable, and socially responsible. And so taking this more systems perspective, so food is being how it's produced, how it's processed, how it's distributed, all the way to how it's consumed or how you deal with waste, there are health impacts all along the way. So while a traditional approach to nutrition might say eat more omega-3 fatty acids, but if we are overfishing and we're taking these from a system that is not going to be able to support humans and our ability to eat healthy food for now and generations to come, is that food in and of itself healthy? And so we take this, what we call environmental nutrition approach, really looking at it as a system. And one of those is that plant-based diets, so diets that are lower in meat consumption are healthier both for the individual as well as for the environment. Our industrial agriculture system has a number of impacts for the environment in how we produce our food. So livestock accounts for, I think it's about 1/3 of our greenhouse gas emissions in the US is from the food sector worldwide, and our raising of livestock is a significant portion of that.
The methane, I guess?
And the carbon dioxide, and also how we how we are raising them in what we called confined animal feeding operations.
Okay.
Has a lot of energy input in terms of sustaining them. There's a lot of water that's used in growing crops for animals to be able to eat and consume. And so while the nutrition of a plant-based diet is healthier for humans in terms of obesity, cardiovascular disease, diabetes, a plant-based diet is also healthier for our environment in terms of air pollution, water pollution, and conserving our really scarce resources.
So the hospitals are encouraging their dietitians to come up with menus for their patients that are less reliant on meat. Is that the idea?
Mm-hmm. For example, St. Joe's offers at least one vegetarian or vegan option in all their meals, both within the cafeteria and for patient meals. And they're looking at this as a way to also be able, they've also reduced their portions, their meat sizes overall across their menus, which allows them some cost saving, and they can then invest that cost saving in more sustainably produced meat options, but also promoting the health of their patients.
And I guess it's, I mentioned meat, but I guess it's dairy too, because dairy has a big carbon and water footprint, I guess. Yeah, so we have a real life example here of a hospital that is actually working towards this promoting healthy food. In fact, I just heard today that St. Joe's won the Washtenaw County Environmental Excellence Award this year. Congratulations.
Thank you.
That's great. So Dan, when was the farm first started?
The farm was first started, we broke ground with a horse-drawn plow in 2010.
That must have been fun.
Yeah, it was fun.
And how can you describe, the facility today?
Sure. Yeah. So the farm itself, we've converted 23 acres of land at St. Joe's Hospital now to farmland. The majority of that is used for hay production, and we have about a quarter of an acre of vegetables being grown and fruits being grown on the hospital property, both outdoors as well as in 3 greenhouses. 2 of which are set up for year-round production of fruits and vegetables, and the 3rd one which is set up for wheelchair accessibility and is more of a patient-centered space.
Great. What does it take to be a wheelchair accessible greenhouse?
Well, we have we've put in floors into the greenhouse, so it's not soil; it's actual solid floors.
You're not sinking into the mud.
You're not sinking into the mud. The beds are raised; they're raised to various heights to accommodate different abilities. And part of part of our reason for converting that 23 acres is to address the way we're using our land at St. Joe's. So we wanted to look at a better way of using it than just lawn. We wanted to have a more sustainable way of using it. So we thought, let's do a farm. I'm not going to grow 23 acres of vegetables just because that's a larger scope than we want to do with the project. So we brought in a partner farm to do hay on the larger acreage areas. So we really find that that's a better use of that land. And he's growing the hay without chemicals.
Great.
Yeah.
Great. Just to clarify, what's the downside environmentally to large expanses of lawn?
Well, large expanses of lawn require large input of water to keep that lawn green. It also requires often inputs of other types of lawn chemicals, such as herbicides are commonly used to kill broadleaf plants to keep it all the same type of grass that you want on your lawn. So we've moved away from that on a huge portion of our hospital campus.
I've heard there's grub killers that kill honeybees too. The systemic imidacloprid or something like that, but neurotoxins. So if you're putting in organic hay, that's really great.
And that's become especially important for us now because we have honeybees at the hospital now, so we want to be sure to keep those honeybees healthy.
Oh yeah, that's right. I saw there were a couple hives. It's an Ypsilanti program.
Yeah, we partner with the Ypsilanti Food Co-op on their local honey project. So volunteers come and they help take care of those hives. Some of the honey goes to people in the community and some of the honey goes back to the Ypsi Food Co-op for sale. And we get the benefit of having the pollinators on our site and the educational aspect.
Wonderful.
Yeah.
So who are the different kinds of patients that would benefit from, not just patients, but it sounds like you have community members coming into your farm too, right?
Yeah. So we have volunteer programs, so people come to our farm, and some of the patients that are coming to our farm are coming for occupational or physical therapy reasons. I've recently learned this term, relaxation therapy, which the therapists are bringing people out for, and I'm really glad that we've been able to foster this type of space at St. Joe's that is thought of as a relaxing space. We also have people from the community and people who work in the hospital come to the farm. They're coming out to the farm for a variety of reasons. Some are interested in learning how to garden. Some have gardened their entire lifetime and are interested in being part of a project that is relating healthy food to healthcare, and they just want to be a part of kind of the excitement of our program.
Isn't there a close head injury group that comes out too?
Yeah, so we partner with a local organization here in Ann Arbor, Eisenhower Center, who works with people who have had traumatic brain injuries. So they partner with our farmers market. They come to our farmers market and they sell produce and body care and craft items that they make in their enrichment programs, and they have a client from Eisenhower Center who comes and sells in that venue. And they also bring clients out to the farm and to the wheelchair accessible farm, where they actually help create the wheelchair accessible greenhouse, they help build it, and they help plant and maintain the plants that we have in the greenhouse there.
And they have a hydroponics thing they're starting too?
They do. They're launching a hydroponics setup using organic methods to grow vegetables hydroponically, and also they're setting up an aquaponics system, raising fish in conjunction with vegetables and having closed loop nutrient cycles where the fish are benefiting the plants and the plants are benefiting the fish. So excited to be able to demonstrate that at St. Joe's.
Great.
Yeah.
And you do have vegetables growing year round, right?
Correct. Yep. Yeah. This time of year right now I have, I'm at the tail end of having things like carrots and beets and spinach that I planted in the fall. So it's mostly, in the winter time, it's mostly leafy greens, root crops, and we do scallions as well. Then once we get to February, late January and early February, I start planting again. So we're able to get a really early start. So we're able to grow both year round, but we're also able to have season extensions. So my tomatoes and peppers are able to last for longer into the fall. And then my things like carrots and greens, I'm able to get planted really early in the spring, which is great.
And what do you do with what you grow?
The produce that we grow goes to a few different places around the hospital. The first place is a farmer's market. So we have a weekly farmer's market, and it's 2 times a week in the summer in the hospital lobby on Wednesdays from 11 to 1. We also have donated about a third of what we've grown to food gatherers.
Great.
And we also provide, in season, we provide cherry tomatoes for our patient meals on the menu, and also for our deli in the Reichert Health Building.
Great.
Yeah.
And are farms at institutions a new idea?
They're a pretty new idea, yeah. We weren't, when we were getting started in 2010, we weren't really able to find other examples of farms on hospitals, so we felt like we were breaking ground and starting a new and first of its kind project in the United States. Since then, we have identified some other hospitals around the country. We've talked to partners both regionally, like Henry Ford Hospital in West Bloomfield now has a greenhouse where they're growing hydroponically for their kitchen. And the grower there and me, we have a great relationship, and we partner with each other. And we've had people call us from around the country, and we've identified other projects from coast to coast now that are doing some sort of food production on the hospitals, sometimes small with a few raised beds, but with the goal of educating people and providing some food for the institution.
I'm really glad. It's a wave that seems to be catching on.
Yes, absolutely.
But I just want to throw in this one idea that we used to have hospitals with farms, right?
Yes.
Back in the old days.
Yep.
Yeah. Because you were mentioning when I was visiting, you said the state hospital in Traverse City used to have a farm.
Yeah, they used to have a quite large operation that was fully self-contained and fully functioned. They had a dairy, they raised meat, they raised fruits and vegetables. So yeah, we can look to those early projects for inspiration also as we do this work.
And there's so much data that says that it's therapeutic to be around animals, to be around food that's growing, see things changing. And
yep, absolutely.
Do you use organic processes? Or?
Yeah, we do use organic methods of growing. We're not certified organic, but my training in agriculture is in organic production, and I believe very strongly in and creating a healthy soil environment for our plants to grow in. So the focus is really on the soil and making that soil a good environment for the plants to grow. The healthy soil leads to the healthy plants, and the healthy plants then lead to the healthy person, which is kind of the foundation of organic farming.
Great.
Yeah.
And it's less processed. We were talking about that before the show, how maybe there's some ways to look at processing as embodying more energy that has to go into the manufacture and the transport.
Yeah, I think that's right. I mean, I think if you really think about processed food versus whole foods being moved around the country, whole foods are moving from, they're moving from a field, maybe for minimal washing, and then to where they're going on a truck, which can be a long distance. But if you're thinking about processed foods, a lot of times there's huge amounts of energy that are being transported to process those foods, huge amounts of water often that's going into process those foods. All of that needs to be moved around, and there's energy that goes into that. The packaging materials for processed foods, if you think about, they're being manufactured somewhere, then they're being moved somewhere to be stored, then they're being moved somewhere to have the food go into them. So there's so many more large actually movements of different pieces happening for processed foods.
And the
to more
solid
energy.
waste too.
Yep.
Because all the packaging.
Yep, exactly. Yeah.
We have a minute more. Nikki, do we have time to talk about your fresh prescription program? That was something that the doctors were prescribing vegetables instead of medicines?
Mm-hmm. So it's actually based on a model that was started here in Washtenaw County through the Washtenaw County Public Health Department. And it's really getting at this idea of connecting the healthcare sector and our food system. I mean, food and health are so intimately connected and tied together, and yet often it's not spoke of more beyond eat more fruits and vegetables, eat a healthier diet. But I think that the program like Prescription for Health, or that which we've created in Detroit, is linking hospitals and healthcare sites with fresh local food within their communities, and really getting at, do people have access to healthy food? Do they know how to eat it? Can they prepare it? Can they afford it? And so doctors are actually writing prescriptions for fresh local fruits and vegetables to their patients, so connecting them to a local healthy food resource that then supports farmers, their local community, as well as better health. And it has elements of nutrition education, cooking demonstrations that go along with it. And actually, part of the St. Joe's Hospital system is involved in that program and looking to expand it. So really helping people understand that what they're eating and where their food comes from has a major impact on their health.
Exciting program.
Absolutely.
It makes me think about Washtenaw County has been trying to encourage people to not flush their drugs down the toilet, and because it gets into our waterways and is bad for the ecosystems, but also it gets into the drinking water. And I was reading that 70% of Americans take prescription drugs, and that the number one medication that they find in the wastewater treatment plants is the high blood pressure medication. So if we can eat fresh vegetables instead of having to take so many medications, maybe we'll actually have an additional benefit to the environment. So it seems like there's just so many interconnections as to how human health helps the environment, and there's all these win-wins. Great. So how can people get more information about the Hospitals Without Harm? What is it called?
Healthcare Without Harm.
Thank
they
you.
can visit noharm.org.
Okay.
Or healthyfoodandhealthcare.org is specifically around the healthy food programming.
Okay.
We also have a number of resources at ecocenter.org.
For the Ecology
For
Center.
the Ecology Center. And we do a range of work with the healthcare sector and sustainability.
Great. And how can people get more information about the farm at St. Joe's?
They can check out our website, stjoeshealth.org/thefarm, or our blog, stjoesfarm.org.
Great. Well, thank you so much for being here today, both of you. It's been wonderful.
Thank
Welcome,
you.
thank you.
For an online archive of today's show, go to ewashtenaw.org/greenroom. Thanks for joining us here in the Green Room.